they try to conceive to have a baby, they take about 5.1 months. So that means in 1 month, they have the chances of having a baby is 20% or 0.2 probability. So over a period of about 6 months, 50% of them conceive. At about the end of the year, you will see around 80% of them would have conceived. So that is the reason we wait till about 1 year, and then in case if they don't conceive, then we start in doing all the tests there. So it can be a man, 1/3 of the problems will be with the man, 1/3 it will be only a woman, another 1/3 it will be both man and woman together. For example, there will be a tubal block, there will be a low count, both put together in that couple. So that is the last 1/3. So at a given time, you have more than 50%, the man is responsible, female is responsible. So if you take the man, normally what we call this as a sperm test, semen analysis is a simple test. At the end of it, we can have no count, where he is not able to have any count, or it could be low count, or it could be a normal count. If it is a normal count, we focus on the female side and investigate. If it is on the low count, we use some methods of medical management to improve the count so that they can have a normal conception. And if there is no count, we have to find out whether it is being produced in the testis and not being transported, or it is not at all being produced in the testis. Today, we have excellent tests to find out what is the issue, and based on that, we have technologies which I'll just at the end of the talk I'll tell you. So we have technologies with which almost all men can have a baby with or without sperm in the ejaculates there. Abnormalities which will be addressed by surgery, and then we can make it all right. With all this factored together, the first time to have a baby. Anesthesia as an outpatient procedure, patient can go home within an hour. What we call it as IUI. This is a very, very popular method, but there are some criteria. One is the tubes has to be patent. She should be ovulating or made to ovulate, and the count has to be normal, at least between 5 million and 10 million. If it is 1 million and less, we cannot do an IUI. So when you do one IUI, you have chances of conception is roughly about 20%. If you do 2, probably 25%. If it is more than 3, it comes down to 11. So we say do 3 IUI, failing which send them for IVF. What is IVF? Instead of normally the woman ovulates.
Are there. It's quite informative. We will talk it offline. I would like to thank our chief guest today, Madam Honorable Member of Parliament, Dr. Tamazhi Thangapandiyan, for sparing her time. I know this is a very, very hectic time when the elections are nearing for the country, and you gave your time. Thank you very much, ma'am. Dr. Anil, Dr. Tendral, we have the fertility consultants, Dr. Ramya, Nitya, and Rajalakshmi, and all my colleagues. So now Kauvery is in the 25th year. So last Sunday we celebrated the 25th year anniversary. It looked as if we started a few years before. We still feel young. Some of my colleagues told that we are already old. But I think we have a long way to go. So what we started with just mere for a trauma and critical care 25 years before with 30 beds. Today we have grown, we are happy, but I think we have a long way to go. But we started with the trauma and critical care. Today we have spread across all the cardiology, oncology, transplants, all the departments. But we thought as we started moving, we felt there's a need for a comprehensive mother and child care. When you say mother and child care, it is obstetrics, gynecology. In the gynecology, Dr. Tendral is here. We have endoscopic, laparoscopic gynecology, we have fertility and pediatrics, neonatology. I think that we want to do as a subspecialty. The first hospital we have launched in Trichy on January 29th with 200 beds only for mother and child care. At any given point of time, we have 50 babies below 28 days. That's the amount of volume what we are trying to do there. And the next 3 years, we want to focus in all the locations, wherever we are present there, focus on the mother and child care. I think under Dr. Tendral now, I think when we are doing practice in the early days when I was in Trichy. Dr. Gopinath's name is there in the country, in the southern part of Tamil Nadu. He comes and travels all over the part, and the most difficult for the embryo transfer, he used to be there. I'm very, very happy, and thank you very much for being part of this. And he
fertility center has been launched. என்னோடு கலந்து கொண்டிருக்கின்ற புனித தோமையார்மலை ஒன்றிய செயலாளர் அன்பிற்குரிய தம்பி திரு வெங்கடேசன், ஒன்றிய குழு தலைவர் சகோதரி சங்கீதா பாரதிராஜன், நன்மங்கலம் ஊராட்சி மன்ற தலைவர் தம்பி திரு கிரி, fellow doctors who are a part of this wonderful inauguration, and all the medical team as well as the team of nurses, the office bearers, everyone. எல்லாருக்கும் என்னுடைய அன்பான வணக்கம். நான் படித்ததிலே எனக்கு ரொம்ப ரொம்ப பிடித்தமான எமர்சன் அவர்களுடைய ஒரு சொற்றொடர் ஒன்று உண்டு. ஒரு ஆரோக்கியமான குழந்தையை உருவாக்குவதன் மூலமும் அழகான ஒரு சிறிய தோட்டத்தை பராமரிப்பதன் மூலமும் சமுதாயத்தில் மிகவும் பின்தங்கிய வகுப்பினருக்கு இலவசமாக கல்வி கற்பிப்பதன் மூலமும் நீங்கள் இந்த உலகத்தை முன்பு இருந்ததை விட மென்மேலும் அழகானதாக ஆக்கிவிடுகிறீர்கள். And how beautifully Kauvery Hospital has made this particular place today as the most beautiful place in Chennai by inaugurating a wonderful Maa Kauvery Center, especially for fertility, which is not actually connected only with female but also connected with male. Thank you, Dr. Gopinath, for such a enlightening introduction about this center. And before going to his remarks, I'd like to congratulate this Kauvery hospitals. As has been rightly pointed out by Dr. C.K., you're very young still, but the steps are not baby steps, I think. You have taken up a giant leap, I believe, constructing so many other departments, not merely the cardiologist and the other sections. I believe, how many floors, doctor? 12 floors. And this, another news to be congratulated is in Trichy, a full-fledged caring center for both the mother and the babies. And almost every day, 20 babies are there being taken care of. ஒரு மருத்துவமனை தன்னை விரிவுபடுத்திக் கொள்வதிலும் பல்வேறு தளங்களில் ஈடுபட்டு மக்களுக்கு சேவை செய்வதும் இயல்பான ஒன்றுதான். எந்த மருத்துவமனையும் புதிதாக தொடங்கப்படும் பொழுது அடுத்த கட்ட நடவடிக்கைகளை அவ்வாறே மேற்கொள்வது சகஜம், வழமையான ஒன்றுதான். ஆனால் மிக குறிப்பாக இந்த மா காவேரி என்கின்ற குழந்தை இல்லாத தம்பதியருக்கு குழந்தை தருகின்ற அந்த சிகிச்சையை அது மேற்கொள்ளும் பொழுது அந்த தொடக்க விழாவிற்கு என்னை அழைத்தது என்பது எனக்கு கூடுதல் மகிழ்வு. I'm so happy to inaugurate that section being a woman, and I'm also enlightened by the facts which Dr. Gopinath has shared it here, because there is a lot of taboo attached to it, especially women. We bear the
fertility center like it's a state of art IVF laboratory. We could perform basic ART treatment lende latest advanced technology varaiku techniques varaiku nammala perform panna mudiyum. Adhe mari couple with repeated IVF failure irukravungalukku நம்ம detailed testing பண்ணி அவங்களுக்கு தகுந்த மாதிரி treatment கொடுக்க முடியும். So I strongly believe that Maa Kauvery Fertility Center is going to be one of the center of excellence in near future under the guidance of Chairman Sir and Dr. Gopinath Sir. Thank you for this opportunity. Thank you.